Chapter 8, Heart and Blood Vessels, Screencast 5. Now, this is the last screencast for Chapter 8, and it is focusing on cardiovascular disorders. Now, when we look at cardiovascular disease, and these statistics are probably a little bit on the low side, greater than 740,000 deaths per year are associated with some type of cardiovascular disease or heart disease. It is the number one killer of males and females in the United States. Now, if we look at examples of what cardiovascular diseases are, we have high blood pressure, aneurysms, atherosclerosis, so that is once again hardening of the arteries, angina, now that's chest pain, heart attack, which is also known as a myocardial infarct or MI, heart failure, an embolism, which is a clot, which quite often will cause either a pulmonary embolism or a heart attack or stroke. So all of these combined are considered to be cardiovascular diseases. And as noted, they are the number one killers of Americans overall, and that includes both males and females. Now, when we talk about angina, that's chest pain. Now, that's a warning sign of a problem with blood flow within the heart itself. Now, generally, how people will feel this is pain or tightness within the chest itself. Now, what's happened here is there is a narrowing of the coronary arteries, and what that means, there's less blood flow to heart muscle. Now, this may also be accompanied by shortness of breath, a feeling of suffocating or choking. Now, generally, this is temporary. Now, angiography, that is a clinical procedure in which dye is injected, and they actually measure and can look at blood flow through the coronary arteries. So that's a visualization, and it can actually enable the diagnosis of angina and those areas which are not getting enough blood because of a blockage. Now, generally, this is treated a number of ways. There are a number of medications to treat this. Balloon angioplasty. Now, this has probably gone a little bit forward. You may have heard of someone getting a stent, and that stent is actually placed in the coronary artery through a balloon angiogram. Or, in very severe cases, someone may actually need a bypass surgery, coronary artery bypass graft, or the abbreviation CABG, C-A-B-G. Here, this is an image of an angiogram, so you can see pretty clearly the coronary vessels, but here you can actually see the blockage. So these areas, downstream, are not going to be getting as much blood flow, and that can result in chest pain. Now, when we look at a heart attack, that can actually is permanent damage to tissue. That's because the decreased blood supply is actually caused heart muscle to die. Now, typically when someone is having a heart attack, they're going to be experiencing intense chest pain, tightness or pressure within the chest. You may have heard of radiating left arm pain. Remember we talked about referred pain in chapter 12? That's really what we're looking at, okay? And that can radiate up down the left arm, okay, into the jaw, back, or result in nausea. Now, this is an emergency situation, and it requires medical attention immediately. Generally, how this is diagnosed, there are electrical abnormalities that can be seen in the ECG, but one of the things that they're looking for are certain enzymes within the blood. In particular, the one that they use most often is troponin levels. Okay? Now, generally, the treatment or prevention is control of arrhythmias, because generally it's the arrhythmia that potentially is the most dangerous situation. People will also be given clot-busting drugs, okay, because quite often what's causing the heart attack is a clot that is obstructing one of the coronary arteries. Or once again, if it's severe enough, generally now they will only bypass people if they have a lot of blockages, so typically 4 or more. I had an acquaintance of mine who recently just went through a quintuple bypass. So this individual had 5 blockages. Okay. Now, generally what they do is a vein from the leg is grafted, and that actually goes around the actual blockage. And we can kind of see that here. So here's the plaque. Okay, and basically what they're doing, you can see the grafts. They're going around. So they're bypassing these areas of blockage. So if you know anyone that has had bypass surgery, that's really what's happened. And also you'll see that they have a scar that basically is midline their entire chest. Okay, so very invasive procedure. And that scar actually looks like a zipper. Very, very large scar overall. Now, heart failure, this is when the heart is no longer really effective at doing its job because of a weakening of heart muscle itself. Now, congestive heart failure, this is when weakness of the heart itself causes fluid to back up into the interstitial spaces. And what you will see is a lot of swelling. These individuals are out of breath. Swollen ankles, legs, and especially in the neck area or in the face. My father actually died at the age of 63 from complications associated with heart failure. Now, generally, there are a couple of things that actually cause the heart to weaken. Greater likelihood as we get older. There may be previous heart attacks that have damaged heart muscle, so you can't generate as much contractile force. There may be valves that have become leaky, or lung disease such as a pulmonary embolism. Now, the treatment overall is to improve cardiac performance, and this quite often can be done through a number of medications. Digitalis is one of them. ACE inhibitors. Okay, so lots of different drugs are commonly used. Now, the other thing is the prevention of that interstitial fluid. So someone might be given a diuretic to increase fluid loss. Now, a stroke, this is actually damage to blood vessels within the brain. Now, what happens here is there's an interruption in blood supply to the brain. Now, typically there's 2 causes. There could be an embolism, and that's actually blocking a blood vessel within the brain, or it could actually be the rupture of a cerebral artery, and that would be an aneurysm. Now, the symptoms are dependent upon the area of the brain that's affected. This is requiring immediate medical care. The sooner medical intervention takes place, you're really increasing the prognosis and minimizing the potential damage. If embolism, then that person will be getting these clot-dissolving drugs. If it's an aneurysm, quite often it's too late. There may be the ability to repair the vessel surgically, but quite often, if it's due to a rupture, they tend to be lethal. Now, the recovery will require extensive rehabilitation. Now, you may know someone that has suffered a stroke. Really good example, if they have a stroke that's affected the right side of the brain, that will result in damage or issues on the left side of the body. Remember, there's that crossover that occurs within the brain. And it's not uncommon that these individuals will really require a lot of rehabilitation dependent upon the severity of the stroke and how much of the brain was actually damaged by the decrease in blood supply. Now, quite often an individual may need a heart transplant. A perfect local example here is the weatherman Scotty Hesko. You may have noticed prior to his treatment, he was off air for a long period of time. There was a period of time when he was on air, he looked very unhealthy. He was very swollen and so on. And think about the symptoms that are associated with heart failure. So swelling is one of them. And you could tell by looking at him prior to his heart transplant that he was definitely sick. And He ended up getting a heart transplant a few years ago. Now, heart transplants, once again, very expensive. The typical post-transplant survival rate is about 15 years, but once again, that is going to be dependent upon how well that person is taking care of the heart. Okay. Now, the issue here is there's not a lot of hearts available. Now, one thing that has been a good thing, okay, and I'm using this very carefully due to deaths related to opiate dependency and overdoses, there has been a greater availability of organs for transplant because of this. Okay. Now, Strong is one of the only hospitals in the western part of the state that actually does heart transplants. Now, we talked about this earlier. What can you do to reduce your risk for developing cardiovascular disease? Don't smoke. Okay. Now, I'm moving up, engaging in regular moderate exercise, because we now know that not exercising is almost as big a risk, if not greater, than smoking. Then we have the dietary aspect of things. You want to watch your cholesterol levels. So you really want to minimize your intake of foods that are high in saturated fat. Those are known to increase cholesterol levels. Keep in mind, cholesterol is a product only found in animal foods. Okay, you want to monitor your blood pressure regularly. If you have high blood pressure, you want to make sure that you're treating it in some manner. Body weight is really important. Okay, one of the major things that will cause a decrease in blood pressure is actually loss of body weight. If you are diabetic, doing as much as you can to regulate and normalize blood glucose levels. And also you want to avoid chronic stress. All of these are things that you can do, or behavioral changes that can reduce your risk for cardiovascular disease.